Marianne Proctor, State Representative for District 60, Southern Boone County. Jamie's going to give you a little bit of testimony, but I wanted to respond to Senator Meredith. And Chair, I thank you for the opportunity to be able to continue to discuss this. I was hoping that we would continue the task force and have the discussion, but clearly that didn't come to be. I'm not unsympathetic to what's happening in rural. I think there's a conflation between reimbursement and certificate of need. We have certificate of need in Kentucky. And since 2005, we've had 4 rural hospitals closed with this in place. It's a conflation. This is a constituent-driven issue. People in my district are clamoring for choices in their healthcare hospitals. We don't have that, and you can say you can look at the market, but if we have to take our healthcare dollars to Ohio, we're taking our employees to Ohio. A lot of people can't travel, and I've heard the solution. Yeah, you have choices with a car and a bridge. For a lot of my people, that really doesn't work. Sunday afternoon, driving up from Union, Kentucky, up to Ludlow, Kentucky, took over an hour. That's on a Sunday with no traffic. It's not like it's down the street to go across the street to Ohio. The things I have concerns with, when you have a dominant providers can also swoop in, not-for-profit, and close rural hospitals. We had that happen. Our dominant provider in Northern Kentucky went to Owen County, bought out that ER, maintained it for 16 months, said, nope, it's losing, and sold it. So now they no longer have an ER and lost some lab services and some radiology as well. There was another competitor wanted to come in as recent as 2017, bought property up in Northern Kentucky, went through a 2-year battle to get a certificate of need, went through that entire process, spent over $1 million in attorney fees and in all the application to go through that process. They were given the certificate of need from the cabinet. They played the game and went correctly, but they were sued out and lost at the circuit court level. And the dominant provider said, no, there's no need, even though the cabinet said there was. And what's ironic today is that same dominant provider that said there was no need is now building on that very place that they sued the competitor out from. So yes, I did bring legislation last year. One of it was to repeal certificate of need for specific industries, things that this body and that was they were tasked with before the implementation of Obamacare, the Affordable Care Act. Where was Kentucky deficient? In 2013, we were deficient in services as mental health, in hospice, home care, ambulatory surgical centers were just a few. We were deficient in 2013, but the General Assembly didn't act, probably due to outside forces. Here we are in 2024, and we still haven't moved. We still have certificate of need for those services, and I don't think anybody can say we've got enough mental health, we don't need any more. We have enough chemical dependency treatment, we don't need any more. So yes, I did bring that, and the only other bill I brought was to eliminate competitor veto. It did nothing to change the certificate of need process. All it did was allow level playing field for somebody who wants to come into the state of Kentucky to go through those steps, apply through the cabinet, let that cabinet make the decision from all the burden of proof that is on the new provider, not to be sued out by the dominant provider that would see that as competition. Unfortunately, that failed, but that doesn't mean that I think we should let it go. So that's kind of my perspective, where we came from. There needs to be a solution, but I think we need to be clear on payment systems, which is clearly problematic. The things that Senator Meredith brought up, many of those are valid points, but not letting anybody else that is ready, willing, and able to come into Kentucky. What other industry do we allow that? But we're doing it with our most important, which is healthcare.